Hi, my name is Kylie Wong, a Stanford All-American and linebacker in the NFL for 9 years. There is no doubt that being a linebacker in the NFL is a rough way to make a living, especially since your job description is to be as tough as possible and hit your opponents with everything you have. We spend a lot of time training to prevent injuries, as well as countless hours in the training room in an effort to recover from the demands we place on our bodies. But even with all that, your body eventually says enough is enough. And the reality is, everyone in the NFL gets injured. And unfortunately, that's what happened to me in my career as well. The last decade has been incredibly exciting for regenerative medicine. PRP, microfracture surgery, and other treatments have been around for about 15 years or more. And there's nothing that was out there during my playing days that we as pro athletes hadn't heard of. Just like many of my teammates, I had surgeries and tried different approaches. But back in the early 2000s, I would say the results were just mixed. But it laid a foundation for what regenerative medicine is doing now, which is to use your own body's ability to heal itself. Like everything else, technology and science have evolved to create better and more effective therapies with better rates of positive outcomes. In my opinion, this is a primary reason regenerative medicine is the fastest growing sector of healthcare and why so many people, including me, are trying to learn more so they can avoid expensive medications or costly surgeries that come along with downtime and no guarantees. At 42 years old, and after having a career in football, all of my joints were a mess and had experienced a lot of trauma, pain, and inflammation that only accelerates the degeneration process. I've been told that my joints are more likely to be seen in people that are in their 60s or 70s. That concept was really hard for me to wrap my head around because I am still very young and my mobility is extremely important to me, especially since I have 4 active children that I want to chase around all day. I plan on staying active the rest of my life, but at times, the amount of cumulative damage from the NFL that I was walking around with would bring me back down to earth. Losing mobility touched all aspects of my life, including my mental health, my energy levels, and even the way I slept. Sleeping was probably one of the hardest things because when I would lay down at night with all the achiness in my shoulders, it just made it difficult for me to fall asleep. Not to mention, it would wake me up, throughout the night. I'm not one of those people that operate well without sleep. I'm gonna be the first to admit that I was grouchy when I wasn't getting enough sleep. I knew I had to do something about this and was determined to educate myself on what was going on in the world of regenerative medicine. And so I reached out to my network, who were friends that included physicians, former teammates, business colleagues, and so on, to get knowledgeable about regenerative medicine. Of course, I was already familiar with the basics and had heard about stem cells, but as I tried to read more, there seemed to be a lot of mixed messages out there, and it was really confusing to navigate by myself. So when one of my friends showed me what they were working on and shared with me the science and the treatment algorithms they had been using to see results, I was hooked. It complemented everything I believe because our bodies are truly made to heal themselves without all the drugs and without all the potential side effects. I want to try this is what immediately came to my head, and specifically thought about my shoulders because the range of motion was beyond subpar. I also had problems with my knees, and having multiple surgeries on them, I just kind of figured this is just the way I was gonna have to live. My first call was to my good friend, Dr. Mark Addix, a Harvard-trained physician, leading orthopedic surgeon in Houston, and also a former NFL player. I asked him, what do you know about regenerative medicine? And of course, he knew and had been using PRP for years, along with amniotic fluid, but was well aware of the advancements that were being made in the field.
We all know about stem cells, and we know that when it comes to regenerative medicine, it's not a one-size-fits-all approach. We hadn't seen a lot in the industry that was different, but when we met the guys at the Regen room and saw that they had built this premium product portfolio that offered a wide range of therapies that can create a personalized treatment program. More importantly, their products were the best, and they had demonstrated successful outcomes with a deep understanding of how to implement this into a medical practice as an alternative to surgery. We like their product Alpha 2 Active a lot. It's natural and it relies on the patient's own blood to extract the A2M molecule. Best of all, it works regardless of patient age, which is a limitation for most autologous stem cell products out in the market. I tried Alpha 2 Active on a patient who travels overseas a bunch and is super active. He'd been experiencing chronic hip pain for 5 years. He called me from overseas to let me know that he hadn't felt this good in a long time.
I was ready to go by this point. All I want to do was get on the schedule and get my procedure done.
The Alpha 2 Active process potentially can produce enough A2M molecule for multiple injections in most patients. For Kylie, he was like a racehorse. We got so much A2M molecule that we had enough to inject both shoulders and both knees.
The whole process was amazing. I mean, it took less than an hour. And to watch it, firsthand, kind of see the way they were separating my blood, it was fascinating. But what really got me excited is how I felt. And I'm talking about immediately, like within 24 hours afterwards, I started seeing and feeling mobility in my shoulders and my body started to open up. Now give me 2 or 3 days later and it was that much better. I had that much better range of motion and I couldn't believe it how fast this thing worked.
So what was your wife's favorite part about you using Alpha 2 Active?
Man, we can't talk about that. Come on, we're football players, dude.
I know you're a tough guy, but what did you used to do when you went to bed at night?
Well, it is funny because I tell my wife about 3-4 days in, I'm like, babe, my shoulders are feeling awesome. And she goes, I know. And I go, how do you know? And she goes, because you're now actually cuddling with me. Ooh. After 12 years of not being able to literally be in bed because I had to put pillows all around my shoulders to make sure that I could sleep comfortably.
No, I'm with you.
And so it was, so I thought that was a really funny thing that she just was like, oh, I know your shoulders feel great.
You know you feel good when you can get your arm out like this.
Exactly.
And if your shoulders are sore, there's no way you can do it.
It was very difficult to sleep. And I had a lot of issues with that.
I think this is, if not one of the most exciting spaces in medicine. Because as a doctor, you don't want to do surgery on everybody. You want to do something a little bit more conservative. And what Alpha 2 Active does is it gives people something else to use. It gives me as a doctor something else in my toolbox that can keep somebody out of the operating room.
Oh, without question. I mean, I feel like, and I'm sure you probably say the same thing, I retired because of an injury, right? Oh. I believe that had this been available, it would have extended my career at least 2 to 3 more years and allowed me to continue doing and moving in the way that I loved.
No, without question.
Hi, my name is Regen. I'm from Oklahoma City, Oklahoma, and I've had issues with my knees pretty much my whole life, but they really got worse perhaps over the last 25, 30 years or so. And the pain level was at about a 10. And a lot of it came from the time I served when I was in the military. I served 22 years and retired. And during that time period, already with bad knees, arthritis, it just, it compounded on it and made it worse over the years. And at one point, my doctor even told me I was in my late 20s that I had the knees of a 65-year-old man, and I'm 56 now. So I can only imagine what they were really like being at age 56. But the past few months, I was just in so much pain. I scheduled to have a knee replacement on both knees, and I've known about the A2M treatment. I wasn't able to get in because my insurance wouldn't accept it. And then I found the Regen unit and had the procedure done. And wow, Dr. Wong, he took such great care of me. And after 2 weeks of the procedure having it done, it's like 100% different. My knees aren't completely where they are going to be, and I know they're going to get better and better as time progresses. But now I feel 100% better. There is no swelling, all the inflammation is gone away, no pain at night. I can go to sleep with ease. I don't have to have my mind on pain or, just thinking about upcoming surgeries that I scheduled for in about 2 weeks from now. But as soon as I leave them here, I will go and cancel that appointment. No knee replacement. My knees will just continue to get better. As I said, my knee level, the pain level in my knees were at about a 10, or I will say 10, but now it's fairly noticeable. Pain is not there. That's a bit tenderness, but within 2 weeks of having the procedure done, I guess that can be expected. But as I stated earlier, it will just get better over time because it has gotten better, and it continues to get better each day.
How would you say you're walking compared to how you were walking?
My walking has improved drastically, especially considering stairs, going upstairs and coming down the stairs. Coming down is actually a lot worse than going up the stairs. Kind of embarrassing to say, however, I'll say it. Coming down the stairs, I'd come down backwards. It was the only thing that would ease the pain, and the tenderness for me to even come down the stairs. But now I can just come down the stairs without any difficulties, So I am grateful for Dr. Wall and his care team of nurses and assistants. They have taken great care of me, and my knees are continually improving. I would recommend anyone to have this procedure.
I'm Sheila. I'm from Southwest Oklahoma. I had the A2M injection in my right hip. Before I had the injection, it was probably a 7, sometimes an 8. And after I've had it done, it's been 2 weeks, and it's now probably at a 2, but not consistently, so that's a good thing. Yeah. Probably I noticed it more when I was driving my car and I would move my foot from my gas to my brake. That movement would always hurt, and now it doesn't.
Oh, that's awesome. And
long car rides were not a possibility, so for me. 2 hours was probably pushing it, so yeah, I can ride in a car longer. So I definitely would recommend it. I think it's a better alternative than a lot of the things that are out there because I've researched them.
Okay, and you're on. So go ahead and just state your name, where you're from, and what procedures you've had since we started.
Okay, and I don't know if you want to pull that lens cover back because it's running across the front there. Maybe you don't. I guess you got screen so you don't see it.
Yeah, that might help. No, this cover. Okay, go ahead.
Okay, I'm Craig Bullock, 62 years old, from Sapulpa, Oklahoma. Have had osteoarthritis in both knees and both shoulders, multiple scope surgeries on both of those, and just having continuous pain. Didn't necessarily stop me from doing things, it just, I did things with pain and used ibuprofen. I had about 2 weeks ago had the A2M in all 4 joints, both knees, both shoulders, and could tell a difference literally within 24 hours on my knees because I always notice them walking up and down stairs. So I had less pain moving up and down the stairs, and after the 3rd day I didn't even have to use a handrail. I could walk up and down stairs both ways, so that was cool. My right shoulder has lagged behind. It has not caught up to my knees and just gone pain-free or anything. And my knees still hurt at different times. I can get in the right spot and make them hurt. But anyway, it's definitely been different. And I just finished having bone marrow aspirate and injections with the bone marrow and the exosome. So I can't comment on those yet. But
did both knees and both shoulders,
did both
right?
knees and both shoulders with bone marrow and exosomes.
And how did the procedure of bone marrow go? What did it feel like?
You feel the block, and then you feel the pressure when they're going in to get the aspirate. It was uncomfortable, but it wasn't deadly by any means.
On a pain scale, how much it hurt, 1 to 10, what would you say? I know everybody's different. But I'm just
I
curious.
mean, when you feel the sharp stab, maybe a 5 or something like that, but that's just for a split second, and then that's gone till they stab you again.
Right. Okay, great. Thank you so much. That's perfect, actually.
All right.
See if I can get it to.
So my name is Kylie Long. I was a former NFL player for 9 years, played at Stanford. I was an All-American there before then. And so I had a lot of years of damage, kind of on my body. But thankfully, I was able to kind of understand and learn a little bit more about regenerative medicine and was introduced to the Regen room. And, it was probably one of the best things that has happened to me since I retired playing football. Well, before, it was probably around an 8. It was pretty brutal. Like, I couldn't stand to, lift weights. I couldn't really move the way I wanted to. And more importantly, I really couldn't throw a football with my son, which obviously is a 14-year-old. And he's a quarterback, that's kind of important. So it was, I would say it was around an 8. Well, my why is because, as an athlete, one of the things that I was very accustomed to doing was always investing in my body, right? Because I wanted to be proactive. I wanted to, offset the damage that I was doing in football. I looked at life no differently. And the why for me is I did not want to have rotator cuff surgery. I knew I had a torn rotator cuff. I knew that, shoulder repairs aren't necessarily that great. And I didn't want to go down that route because I wasn't committed to having to do the rehab that I was going to need to do in order to get fully better. Well, my aha moment was kind of building, and it probably starts with sleep, right? Because I was having a hard time sleeping. I would have to put, pillows all around me and put this big barricade up to where I wasn't even able to touch my wife. When I sleep, and my shoulders would wake me up, and then I would also have a hard time falling asleep. So my why was partially around movement, but a lot of it was just around, how grouchy I was and how tired I was during the day because I just wasn't getting a very good night's sleep. It was easy. I mean, it was actually amazing at how fast it worked. So, and one of the funny things is I kind of journaled it, right? So I was very accustomed to really understanding what was going on with my body and kind of feeling the difference and experiencing it. So I actually wrote it down, just like I would have, had I been playing. And, at first it was like this very interesting feeling with just kind of having a little bit of fluid in there. And then 4 to 6 hours later, I started to feel really good. And by 36 hours, I was moving my arms through ranges of motion that I hadn't moved through, in a long time.
My name is Jacqueline Mills, and I'm from Goldsby. I came in because my knees were extremely painful and I couldn't do all the activities I wanted to do. So 2 weeks ago I had A2M done in both my knees, and within 4 hours my right knee was already feeling great. I was able to go up and down stairs, and really within 4 days both knees felt incredible. I am able to squat, I can get back up, I can get off the toilet, I shouldn't say that, but I can do that without any pain. It's just really been incredible. I was very surprised because I've suffered with knee pain for so long that I didn't think it was fixable. I thought it was just my arthritis or my lupus, and it wasn't going to be fixable. but I feel like it's still working. I feel like it's going to get even better, and I have every hope to be able to ski next year because they feel so sturdy, and I have zero pain. And I probably had, on a scale of 1 to 10, I was probably about an 8 or 9 on the worst days, but always at least a 4 or 5 because it just interfered with just getting in and out of the car. So I highly recommend it to anyone that is having this. There's no reason to stop life because there's so much technology out there. I'm actually going to see if my 28-year-old son will have it just to prevent any further damage. So I'm very optimistic, and most of all, I'm just really excited because I have hope that I can ski again. So I'm very excited.
The pain early on in my knee was not good. It hurt all the time, and I was looking for something that would relieve it. Scale of 1 to 10, when it hit me, it was a 9 or 10. And you know, when I had pressure, it was bone on bone. And at times when I was walking downhill, I could feel it really bad. Well, I'm still trying to play golf, still want to be competitive, and I can't play as well as I want to if I'm experiencing pain. So, you know, it was important for me to do whatever I could to get rid of the pain. The aha moment for me was whenever I realized I couldn't compete anymore if I didn't do something. And I didn't have an alternative. I knew I couldn't compete at a high level and feel the kind of pain I was feeling. So I knew I had to do something. When Dr. Addix did the procedure, Alpha 2 active, within 48 hours, I was feeling much better. I knew that the future was going to be bright with it, and I was excited. It gave me some new energy to attack what I wanted to do. Well, the anticipation, I've had both my hips replaced, and I really didn't want to go through anything like that. This is a new procedure, it's new medicine. It made me hopeful that I could create some regeneration in my knee that would allow me to continue my career. And that was reason enough to do it. And I got great results from it.